Hi Corey, how are you doing today? My name is Leslie. I'm going to be your nurse practitioner. We're going to go ahead and do a full physical exam, okay?
Okay.
Alright, there's a lot to get through, so let's just go ahead and get through it. I would provide for privacy right over here. Can I get your name and your date of birth?
Corey Joyce, January 9th, 1988.
Alright, we're going to go ahead and inspect the anterior, posterior, and lateral chest wall for symmetry. I don't see any bumps, no bruising, no redness, no rashes. His respiratory rate looks good. You would normally count the respiratory rate while you're doing the pulse or something else. So it's about normal is 18 to 20. He's not using any accessory muscles. He's breathing just fine. Are you having any problems with breathing?
No.
All right. Then I would just palpate the chest wall for tenderness. Does anything hurt?
No.
Palpate back here. Do you feel anything? Anything hurt?
No.
All right, good. Okay, thoracic expansion. I would just get behind him. I've got my hands, and I would just put it right here at the bases of his lungs. Watch him breathe in and out. Good. Symmetrical, and the same with the front, the interior. I'll just put it right down here. Breathe in and out. All right, good. It's symmetrical. No pain there. Then I will percuss the interior wall, and you're gonna go in a lateral movement so you can compare side by side. I will start up at the top, over, down, over, down, over, down, over, on the side, over, and down again on the side, and over. You would do the same in the front using the same ladder. One would be up here, over, down, over, down, over, down, over. Same on the sides, over, down, over. Okay, now I'm going to auscultate. Using the same pattern as I did for the percussion. All right, take a deep breath. Good, out, then over, deep breath, in, out, awesome. Then I would just go down and keep comparing them side to side in the same motion as I did for percussion. So once that's done, I will repeat the same thing, listening, going just from side to side. Awesome, down, over, down, over, side, side, down, side. And of course you would take more time to listen, but we only have 30 minutes and I want to get through everything. All right, next I'm gonna inspect the pericardium, which is right up here. I don't see, it's symmetrical, no bumps, no lumps. Describe the three areas. Okay, the aortic will be up here on the right of the second intercostal space. The aortic, the pulmonic is on the second left intercostal space. Herbs is right under the pulmonic. The tricuspid would be the lower left, over on the sternal, lower left sternal. And then mitral is a little bit more left from the tricuspid. And then epigastric is right down here, kind of above the umbilicus. So then you will palpate the precordium for any 3-pill PMI, and the apical impulse is the 4th and 5th intercostal space. So you just palpate right there. I don't feel any thrill, any whooshes of any kind. Does that hurt? Anything in there hurt? Okay. Then we will go ahead and auscultate the heart. So can you go ahead and lay down for me and rest your head on this pillow? Lay this way. Thank you. So you would listen to the diaphragm, supine, and the diaphragm is used to, it can pick up the S1 and S2 sounds, and then if you turn it over to the valve, this normally picks up the lower tones, S3, S4s, any murmurs. Okay, and then can you lie on this side? And then you would listen to it like this on his left lateral, and then can you sit up for me? And then you can listen like this. And I hear S1, S2. The lub dub. Okay. Inspection, palpation, and auscultation of the carotids. You never want to feel the carotids at the same time. So I would look. Yep. Okay. And then just to auscultate. Very good. Okay, location of the palpable pulses. Can you turn towards the camera? Location of the palpable pulses. We've got the radial, the brachial, the dorsalis is down here on his foot. I don't know if you can see it, but it's down here on the foot. The popliteal, right around the knee, and then the posterior tibia, right here, kind of like on the inside of the ankle. All right, thank you. Next, we're gonna go ahead and inspect and palpate the skin. Everything is smooth. Do you have any rashes I need to know about? Any bruises, cuts, openings?
No.
All right, then you do the turgor where I've just pinched. That's just to check hydration. It goes back down. I'm gonna go ahead and do the capillary refill. Less than 2 seconds, perfect. His fingers look good, there's no clubbing, so that lets me know there's no really respiratory issues. Next, I'm gonna go ahead and palpate the head and the scalp. Awesome. Everything looks fine. The head is normocephalic. Frontal sinuses. Maxillary sinuses. Palpate that. Palpate and auscultate temporal arteries right up here in the temples. And then the auscultate. Really just put it right up here. Okay. Awesome. Inspect the neck and the neck veins. Next, you palpate the neck. The trachea is down here. To palpate the thyroid, I'll come behind. It's right up here. Good, good. And then the lymph nodes. We've got just submandibular, occipital is back here, tonsillar is right here, posterior clavicular, and then we've got the supraclavicular. All right, next is inspecting the eyebrows, eyelids, orbital area, eyelashes, and the lacrimal glands. Can you open your eyes? Just take a look. Are you having any problems with your eyes? Any
No.
tearing? Okay, perfect. Palpation of orbital area, the sclera and conjunctiva. Close your eyes. All right, those feel good. Symmetrical, normal. Direct and consensual response. I've got my pen light. And I'm just gonna say, hey, can you stare behind me? I'm gonna shine this light in your eye. The direct response is the pupil that I'm shining the light in, and the consensual is the movement of the other pupil. Very good. The pupils are equal, reactive to light, and accommodating. All right, I'm gonna go ahead and palpate and look in the external ear. I don't see any lesions, and you would do the same on the other side. Any hearing issues, anything like that, earwax?
No.
Okay. Next is the internal nose and internal nares, and I'm just gonna use my light like if I was in the office. I would go ahead and perfect. And then can you open up your mouth, say ah. I'm looking at the tongue, I'm looking at the soft palate in the back, the mucosa. Can you put it back in? Can you smile for me? Teeth and gums. Lips look good. Perfect. All right. Can you go ahead and lay down for me like I had you before? Yeah, right there. We're going to inspect the abdomen. That's next. Everything looks symmetrical. Auscultation of all quadrants. Okay, first I'll do my bowel sounds, and we normally do them in the 4 quadrants below. And just listening for gurgling or anything like that. Yeah. Perfect. Auscultate of the aortic, which is right up here, kind of midline. Yep. The iliac is it's on the side of the umbilicus, I guess you could say. There's 2 of them. The femoral is down by the groin, and there's 2 of them. And then the renal arteries are more or less on the side of the aorta, if you're just looking for landmarks. Okay. Awesome. Percussion of the abdomen in the 4 quadrants. Just listening. Okay, perfect. Percussion of the liver span at the MCL. So it's the liver, it's right under, kind of under the nipple. The liver would be right here. So the MCL is the mid-clavicular line. Very good. Percussion of splenic dullness. The spleen is right under here. Here's the mid-axillary line. The spleen could be found kind of back here. Sorry, I know my hands are cold. Okay. Next, a light and deep palpation of the 4 quadrants. The Murphy's sign is the right subcostal. Light palpation is 1 hand, deep palpation is 2. Does that hurt? That would tell, if he were to have pain, it might be cholecystitis, something with the gallbladder, something with the liver. The McBurney's point is right down here. You palpate that. Does that hurt? That's a sign of appendicitis. The iliosposa's muscle test. Okay. We're going to have the patient lie supine. You lie supine just like that. I'm going to put my hand on your hip. And then can you push your leg on my hand on your hip? Is there any pain?
No.
Okay, perfect. And then the arbitrator muscle test. 1 hand under and 1 hand on top. And then can you pull your leg up? And then can you flex your knee? Flex your knee, yeah, and then pull it up towards my hands. Does that hurt?
No.
Okay, perfect. And then palpate or aortic pulsations. You use both hands kind of on the side of the belly button. Okay, perfect. All right, next I'm gonna go ahead and inspect your joints and your muscles. Are you having any joint pain, muscle pain?
No.
Okay, can you sit up for me and look towards the camera? All right, we're gonna go ahead and do neck, the flexion, extension, lateral bending, and rotation. Can you put your chin down to your chest? Head up to the sky? Okay, and then can you touch your ear to your shoulders on both sides? Okay, and then can you move your head around? All right, perfect. Okay. Next, we're gonna do shoulders. Can you shrug your shoulders? Put them back down. Can you reach your arm out? Then move it back. Okay, bring it down, and then can you reach behind yourself? Good job. And then can you put your arm out to the side of your body and then reach it across? Reach it across your body like this. Perfect, thank you. All right, next is elbow. Okay, elbow in, out. Okay, good. Let's do wrist. Can you close your hand? Move your wrist down, up, and you go side, inside. Okay, awesome. Next are your fingers. Can you hold your fingers out? Can you move them in, out, in, out? Awesome. No pain there? Okay. So for your hip, I'm gonna have you, well actually, let's stand up. Let's do your knees. So for your knees, I want you to squat down. Squat down. Good job. Stand back up. Great. Okay, sit down. And then can you move your leg just inside? Can you just like turn it inside? Like you're gonna put your leg up on your...
Oh, let's turn it.
Yeah. Yeah.
Actually put it up there?
Well, yeah, you can do that. Okay, then put it down. Okay. And then can you lay down? Just like how we did before. And so for your hip, can you keep your legs straight and then move your legs out, abduct, and then move it in, and can you like kind of cross your legs? Okay, adduct, great. Perfect. And then can you move your leg up, and then can you kind of turn it inward? 1 foot. Good job, and then your other, turn it inward. Awesome, thank you. All right, next let's go ahead and do your ankle.
While laying down?
Yeah, while laying down. Can you scoot up a little bit? Yeah, there you go. Okay, so ankle, let's go ahead and do dorsiflexion, flexion, and then can you do internal rotation, external rotation? Awesome. Let's see. Okay, next I'm gonna have you stand up. And then can you just turn to the side? Thank you. And then bend down, touch your toes. Awesome. And then can you lean back towards me? Okay, stand up straight. Can you lean from side to side? And then can you just go all the way around? Good job. Thank you.
Sit down.
Yep, go ahead and sit down. Okay, let's do the acromyoclavicular joint crossover. Can you just move your arm across your body like I had you do? Perfect. Let's do the Apley scratch test. Can you touch your scapula like this? Okay, and then go under and touch your scapula. Awesome. Good. All right, next is the near impingement sign. I'm just going to have you... Does that hurt?
No.
Good. Okay, next is the Hawkins impingement sign. And that's actually perfect. I'm just going to have you... Does that hurt?
No.
Okay, good. Next is the drop arm test. Can you stand up? And then raise your arm. And then slowly drop it. Good job. Okay, and then next is the empty can test. Can you just hold your hand out? And then move it down like you're emptying out a can. And of course we would do all of these on each side. Perfect. Thank you. All right, Finkelstein test. Can you grip your thumb and move your wrist down? Good job. Good job. Next is the wrist tittle sign. So can you hold your hand out and I'll just tap? How's that feel?
Feels good.
Okay. After that, it is the wrist Phelan sign. Can you go ahead and just touch your wrists together? Awesome. Thank you. Okay. Next, I'm going to have you lay down for me. We're going to do the McMurray test. The patient needs to be supine. Okay, can you pull up your knee and your hip? And then we're going to go ahead and rotate this in. And then have you feel good? Okay, perfect. Next is the abduction. I'll put one hand right here and one hand under your ankle. Here, bend your knee. Sorry, right hand. And then I will just pull your ankle. Okay. And then the next is the abduction test. Hand on the side of the knee, other hand outside of the ankle, and then push ankle. How does that feel?
Feels good.
Okay.
No issues.
Next is the anterior drawer sign. Now, can you just put you might have to scoot up. Can you scoot up? And then just flex your knees. Flex your knees, put your feet right there. Good. The anterior drawer sign. And I'm just going to cup your knee. And then I am going to pull your tibia forward. Any pain?
No.
Okay. And then I'm going to go ahead and do the posterior draw sign, where you would pull the tibia backwards. Any pain?
No.
Okay. Let's do the Lachman test. Supine flex knee at 20 degrees. Place hand on the inside lateral femur, other hand on the inside lateral tibia, and push the femur back and pull the tibia forward. Okay. How was that?
Feels good.
All right, thank you. Next, we're going to do the straight leg test. Can you could put your legs down. This is straight. Keep your legs straight. And I'm just going to raise it. How does that feel?
Feels good.
Good. That's just for lower back pain. Next is the Kemp's test. Can you stand up? With your back towards me. My hand will be down here, down here. Can you lean back? Can you point your, kind of roll towards that? And then hold this for 3 seconds.
1, 2, 3.
How does that feel?
Feels good.
Great. Okay. Next is the FAIR test. You can go ahead and lay down. Can you lay on your side?
Doesn't matter which side.
Yeah, just face the camera. Thank you. Lay on side. And then I will just cup the knee. We just move the knee in and out. That's the internal rotation. Okay. Next is the thigh thrust test. Can you lay back? All right, now you would stand on the patient's asymptomatic side. I would have you, can you just flex your knee about to 20 degrees? Okay. My hand on scrotum. Right there, and then I'll just push the knee. How does that feel?
Feels good.
Okay. The Fader test, flex your knee at 90 degrees, abduct leg, and internally rotate. How does that feel?
Feels good.
All right, and the Faber test is, can you put your ankle on your thigh here? And then I'll just push on your knee. How does that feel?
Feels good.
Awesome. Okay. All right, you can go ahead and sit up for me and face the camera. We're going to do the mini mental exam. Can you tell me what day of the week it is?
Sunday,
Can you tell me what year it is?
2021.
Can you tell me who the president is?
Biden,
Can you tell me where do you live? What state you live in?
the state of Indiana.
All right. So I'm going to name 3 items that I want you to remember, okay? And then I'm going to ask you what they are later on. Let's go ahead and say lamp, TV, cat.
Okay.
Okay, you've got that?
Yes.
All right. Can you tell me what this is?
A pen.
Okay, it's a pen. Okay, can you tell me? Well, I want you to read the sign and do what it says.
Close your eyes.
Awesome. Okay, can you repeat those 3 things I told you to remember?
Lamp, TV, cat.
Awesome, thank you. All right, next. Pupillary reaction to light, which I did that before, but I've got my pen light. Can you look behind me, please? Awesome. Awesome. We're going to go ahead and do the 6 cardinal gazes. Can you just follow this pen light with your eyes, nothing else? Don't move your head. Awesome, thank you. Let's see. Can you raise both eyebrows? Frown. Give me a sad face.
Frown.
A sad face.
I don't frown a lot. Hold on, I'll try.
Good job. Close your eyes tightly. Show your upper teeth and lower teeth. Awesome. Smile. Smile. Puff out your cheeks. Okay, I'm gonna come behind you and I'm gonna whisper something. I want you to tell me what it says. Can you cover this ear?
This ear?
Yeah, go ahead and cover that ear.
3.
Yep, I said the number 3. Okay, go ahead and cover this ear.
4.
Yep, I said the number 4. Awesome. Can you say ah? And just watch the uvula move up, the soft palate, the bottom of the mouth. Thank you. Sternocleidomastoid strength. I am going to put my hand right here and I want you to push against it. Thank you. And then can you do the same over here? Thank you. And I'm going to assess TMJ. I don't know if I did that before, but can you go ahead and open your mouth? Good. Okay, close it. Does that hurt?
No.
Great. Awesome. All right. Next, we're going to check your spinal nerve root innervation. Can you hold your hands out? Can you push against my? Good job. That's out of 5. Can you? Good job. That's out of 5. Can you grip my fingers? Grip them. Good job. All right. Push and pull against hands. Can you push? Good job. 5. They're all 5s. 5 is normal. That's what we would see. Anything lower would be more cause for examination. Next, let's do the lower. Can you push your knees closed? Good job. Can you push your knees out? Good job. Is that a 5? All right, let's go ahead and do your coordination. Can you stand up for me? Can you just walk normally? Awesome. Come on back. Okay. And then I want you to walk on your heels. Okay, and when you come back, walk on your toes. Can you walk with one foot in front of the other? Awesome. Okay, stop. Can you come back right here in front of the camera? And then I want you to do rapid arm movement. I want you to take your hand. Good job. Next, can you do finger tapping? And when you do the finger tapping, yeah, just like that. Good job. Can you do your finger to your nose? You can go ahead and sit down if that's easier. Finger to your nose. Good job. And then stand up, and can you do your heel to your shin? Very good, very good. And of course, we would do each side. All right, stay standing for me. Can you put your feet together? Feet together with your eyes open. And then I would have him close his eyes. Can you close your eyes? And we would have him do that for 30 seconds. And that's for the Romberg test. All right, awesome. Now with your eyes closed, can you put your arms out for me?
Where?
Out like this.
Okay.
And this is called the pronator drift. And just keep your eyes closed. His arms stay. It would be different if he were going like this. That would show something's off there. All right, thank you. All right, can you go ahead and sit down for me? I'm gonna do your reflexes. Now I don't have a hammer, but I do. We'll go ahead and act like this pin is it. All right, Cord. We're gonna do the biceps, which is right here. The elbow, the triceps, right here. You just tap. Brachioradialis, right there. Okay. We're gonna do the quadriceps, which is the patellar, which is what the doctors normally do. There we go. And then the Achilles is behind the ankles. Okay. To check for clonus, can you go ahead and lay down for me? Okay, bend your knee up. And then you would just dorsiflex the ankle like that. No pain?
No pain.
All right. Can you stand up and oh well, let me do the plantar response while he's laying down. And that, can you just raise your foot for me? It says take a key or something mildly sharp, and you move from the heel laterally to the heel to the ball of the foot. A Babinski reflex would be the dorsiflexion of the first toe. All right, go ahead and stand up. Well, not stand up, but face the, All right, last but not least is the Hoffman sign. I'll just kind of come and hold your hand like this, and you just flick the middle finger. Now, if the pointer finger were to flex and the thumb were to adduct, then that would be positive. All right, thank you so much, Corey, for letting me do your complete physical exam.
Thank you for having me.